Let us learn and let us talk about something called rectus abdominal sheath hematoma. Let us define what this is. This is just blood collection or blood clot that forms under the layer that covers rectus abdominis muscle. Most of the time, what causes this is either there is a tear in the muscle or there is a tear in the abdominal artery. And most of the time I've seen this condition after cesarean section. What happens is a patient that goes for cesarean section. Just after cesarean section, the abdomen will keep on swelling and there'll be pain, and maybe there will be fever. The patient will keep on coming to the hospital, given medication, but there'll be no change. So most of the time the doctors will request us to do an abdominal scan just to check what is happening. And what we do, once we do the scan, we will see a hypoechoic lesion under the rectus abdominis muscle. And sometimes it could be just hypoechoic, sometimes it will have internal echoes, sometimes you will have septations, depending on how long the hematoma has been there. So I've always advised sonographers or those who are doing ultrasound, use a linear probe just to look at the muscles around the abdomen. But again, you can also use a curvilinear transducer just to look at the peritoneal spaces, look at the rectal, look at the porch of Douglas, look at the splenorenal porch, look at the hepatorenal porch, look at the paracolic gutters, just to make sure that there is no hemoperitoneum. Again, I've always said you can still go down there, look at the uterus, just look at the space around the pelvic region, just to make sure we are not dealing with any other pathology. So again, I've always said we share this information so that at least people who listen to it, or if there's someone outside there who's going through such a problem, kindly don't fear, go to the hospital. I'm sure once some of these problems, or once this condition is found, there is medication, you're going to receive medical attention, and you're going to be well. Thank you always for listening to my videos. Thank you always for sharing. Thank you always for commenting. I'm always looking forward to speak to you in my next video. Thank you, and have a great day ahead.